All right, so if you or someone you care about is getting ready for surgery, chances are you're thinking mostly about the operation itself, right? But what if I told you some of the most important safety steps happen before you even enter the operating room, and that you are a key player? Okay, let's dive into this.
I mean, modern surgery is incredible. It's a miracle, really. It saves lives and improves the quality of life every single day. But like any powerful tool, there are risks involved. The good news, though, so many of those risks are preventable, especially when the medical team and the patient are on the same page, working together.
And this is such a big deal because the sheer scale of it all is just massive. Every year, we're talking about up to 281 million major surgical procedures happening around the globe. To put that in perspective, that's nearly one surgery for every 25 people on the planet. So you can see how, with that many procedures, even a tiny risk can end up affecting millions of people.
Which brings us right to the heart of this explainer. What exactly is the most common and this is the important part, the most preventable risk that comes along with having surgery?
Well, the answer is something called a surgical site infection, or SSI for short, and it's exactly what it sounds like, an infection that pops up right where the surgery happened. And this is not some rare thing. In a lot of countries, it's actually the #1 infection people get while in a healthcare setting.
Now, what's really fascinating here is the global picture. See, SSIs happen everywhere, but the rates can be wildly different. In high-resource countries, you're looking at somewhere between 1 and 5 infections for every 100 surgeries. But in low- and middle-income countries, wow, that number can shoot all the way up to 23. It's a huge global health issue with a very real personal impact.
So, to really get how we fight these infections today, it really helps to look back and see just how far we've come. Our whole idea of what causes infections has completely changed over time.
And this timeline just shows that journey perfectly. I mean, before 1867, people genuinely thought infections came from bad air or miasmas. Then this pioneer, Joseph Lister, comes along with a game-changing idea. Use antiseptics like carbolic acid to kill germs. Fast forward to 1910, and the sterile gowns and gloves we all recognize become standard. And today? Today, our strategies are so sophisticated, looking at everything from a patient's own health to the literal airflow in the OR. It's incredible.
And that brings us to a really crucial point. Preventing infection isn't just about the surgeon's fancy tools. It actually starts with you. So let's take a look at your personal risk factors.
Okay, so the very first step is just knowing what you're working with. On the left, you've got some risk factors you just can't change, things like your age or a pre-existing condition like cancer. But look over on the right. These are the things you and your healthcare team can often manage before surgery. Things like getting your blood sugar under control, addressing obesity, quitting smoking, and clearing up any other infections you might already have. This is where you really start to play an active role.
So now, let's build on that idea with a practical playbook, some real things you can do. Think of this as your personal safety checklist to make your surgery as safe as possible.
One of the most effective things you can do is preoperative bathing. The whole point is just to reduce the amount of bacteria living on your skin. Your doctor will probably give you a special antiseptic soap, and the evidence is pretty clear. Showering with it the night before and the morning of your surgery is the way to go. Oh, and here's a key tip. After that last shower, don't put on any lotions, creams, or powders. You want your skin to be a clean slate. Okay, now this next one might actually surprise you. A lot of people think they need to shave the area where the surgery will be, but the official clinical guidelines are super clear on this. Hair should only be removed if it's really truly going to get in the way. So why is that?
Well, it's because shaving with a regular razor can create these tiny, microscopic cuts in the skin. You can't even see them. But those little nicks are basically an open invitation for bacteria to come in. So if hair absolutely has to be removed, the standard and much safer practice is to use electric clippers, not a razor.
Another absolutely critical step is giving preventative antibiotics. But with this, timing is everything. See, the antibiotic is given through an IV about 30 to 60 minutes before the surgeon makes the first cut. This makes sure the medicine is at its peak strength right in your tissues, right when you need it the most. It's like a perfectly timed shield against infection.
Here's another one that might seem a little odd at first. Just staying warm. It turns out that being cold right before surgery is actually linked to a higher risk of infection. So those simple things like warm blankets or a forced air warming device, they aren't just for comfort. They are a proven part of the plan to keep you safe.
So you've done your part. Now, let's pull back the curtain a little and see how the hospital staff creates this amazing fortress of safety to protect you once you're there.
You know, the operating theater isn't just one big room, it's a series of zones, and each one gets cleaner and more sterile. In the unrestricted zone, street clothes are totally fine. But to get into the semi-restricted areas, like the hallways right outside the OR, staff have to be in scrubs and have their hair covered. And then finally, the restricted zone, the operating room itself, that requires the whole shebang. Full surgical scrubs, hair covering, and a mask. Every zone is another layer of protection.
You know, this quote right here, it just gets to the heart of everything we've been talking about. The best, most effective safety plans all recognize that you, the patient, you aren't just passively receiving care. No, you are an active participant. You're an essential member of the team that's focused on your own health.
So if there's one thing to take away from all this, it's this. Preventing these infections isn't just the surgeon's job. It's not just the nurse's job. And it's not just your job either. It is a true team effort, and you are an absolutely vital, empowered player on that team.
And that brings us to our final thought. Now that you're armed with this knowledge, you can actually change the conversation. So knowing that you have this active role to play, what's the first question you're going to ask your healthcare team to help make sure your surgery is as safe as it can possibly be?